Chapter 14. Bites and Stings. Bites and stings from animals and insects are not merely painful but often dangerous. Dog and cat bites are the most common, but injuries may occur from other animals as well. In dog bites the flesh is usually torn and lacerated. Cat bites often cause a more serious reaction, because the cat's teeth are sharp and penetrate deeply into the tissues. What to do? Always wash the skin thoroughly with soap and water. Allow the wound to bleed as much as it will. This will help to remove germs. Deep puncture wounds may have to be opened up under local anesthesia. Torn skin should be cut away, and the clean edges drawn together and stitched in place. Be sure the victim is protected against tetanus. This is discussed on page 112. After thoroughly cleansing the injured area with soap and water, pour more clean water over the wound, especially into the deeper parts. Then apply some suitable antiseptic, such as Ceteflon or mercurochrome, and cover with a thick pad of sterile gauze, bandaging this firmly in place. Be sure that large and deep wounds are treated by a doctor. Rabies. Rabies, or hydrophobia, is one of the worst diseases known to man. The virus is carried in the saliva of an infected animal. After being introduced into the area of a wound caused by the bite of the infected animal, the virus passes along the nerves, and finally reaches the brain, where it causes a type of encephalitis or irritation of the brain. Rabies may be transmitted either by biting or licking. The virus, however, cannot pass through unbroken skin. All kinds of animals may carry rabies, including dogs, wolves, foxes, bats, munday-gooses, and deer. Even cows and cats have been known to transmit the virus. But the chief danger is from rabid dogs. Bites on ones. Snake bite 129. Head and neck are particularly dangerous because of the closeness to the brain. Once rabies has fully developed, there is no known cure. What to do? Man is much more resistant to rabies than is the dog. If a dog or any other animal bites a man, do not rashly destroy it. Keep it under observation 10 days, confined in some suitable place where other people will not be in danger. A dog with rabies soon becomes increasingly restless and excitable. It refuses to eat, and indulges in excessive barking and growling. If the animal is not restrained, it may bite many other animals and human beings. Such an animal should be destroyed when the diagnosis is confirmed. Government health officials should be contacted. Thoroughly wash the area of the bite, using plenty of soap and water. Then apply some suitable dressing and go at once to your doctor. He may advise the use of hyperimmune antiserum *, particularly if the public health authorities think the animal is infected with rabies. The hyperimmune antiserum and the rabies vaccine are the only methods available that will protect the victim against this dreadful disease. Snake bite. A poisonous snake has 2 needle-sharp fangs or teeth, one on each side of the upper jaw. At the root of the fang there is a poison gland. When the snake strikes, it jabs downward, hitting the skin with its fangs and immediately releasing a few drops of venom. The snake then recoils, and is ready to strike again. The chief poisonous snakes are cobras, krites, vipers, and sea snakes. Pain and swelling almost always follow the bite of a poisonous snake. The pain is felt immediately, and the swelling soon follows. The skin becomes purple in color. If the fang happen to enter a vein, the poison is quickly carried throughout the body. 2 distinct marks or puncture wounds about 1 inch apart may be seen in the area where the fangs pass through the skin. A drop of blood will be seen over each wound. In non-poisonous snake bites there are merely scratches or bruises. This 14-day series of injections prepared in India by the Pasteur Institute at Coonoor is available through any government hospital in India, or can be obtained by any doctor directly from the institute. Readers in other countries are advised to apply at their local health centers for pertinent information. 130 Common Emergencies in Home. What to do? 1. Tie a tourniquet or ligature around a limb, just above the area of the bite. Use a handkerchief, necktie, shoelace, or other suitable material for this purpose. The tourniquet should be just enough to stop the flow of blood in the surface vessels. You can tell whether it is tight enough by observing how much the veins swell just below the ligature. This tight band helps to slow the absorption of poison. 2. Keep the victim lying down, with the affected limb a little lower than the rest of the body. 3. Sterilize a sharp knife or razor blade, by passing it through a flame. With the tip of the blade make a number of cuts across the area of the bite, about 1/4 inch deep, so that the blood will flow freely. 4. Apply suction to draw out the venom. Do this every few minutes with your mouth. There is no danger if you have no wound or abrasion in your mouth. The venom is not poisonous, even if swallowed. Another good suction method is to heat a small bottle so that most of the air has passed out of it. Press the mouth of the bottle firmly over the area of the wound. As it cools, it will provide succion. Keep the bottle over the area for several minutes. 5. Take the victim to a doctor as soon as possible. 6. If the swelling continues above the ligature, move the band up higher and make a few more cuts along the course of the blood vessel draining the area. Do not put any local medications on the bite unless it be to rub a strong solution of potassium permanganate in the wound. 7. If the victim seems weak or dizzy, give him strong tea or coffee. Never give alcohol. This only spreads the poison through the body more quickly. 8. Lympholysed anti-snake venom serum. Health authorities in most countries provide antivenin to neutralize the poison of the snake. Your doctor will know where to obtain this. Follow the directions carefully. Remember, children require much larger doses than adults. The reason for this is that the smaller and lighter the body of the victim, the higher the concentration of the poison. If necessary, inject 4 or 5 ampoules of antivenin into the muscles around the area of the bite. It is wise to give some antivenin also in the vein, so that wherever the snake poison travels in the body, the antivenin will quickly neutralize its effect. Spiders, centipedes, scorpions. 131. 9. Tinnitus antitoxin should be given to all snake bite victims. At least 3,000 units should be injected, after a proper test dose in the skin has proved that the patient is not allergic to horse serum. 10. Keep yourself calm. Avoid excitement. Keep the victim quiet. With proper care, most of these cases seem to make a good recovery. Prevention: snakes usually bite in self-defense. Watch where you walk, especially in areas where snakes are known to live. You can protect your feet by wearing high boots. Young children should be taught the danger of handling snakes and other reptiles. Always avoid using bare hands when climbing over rock ledges where snakes may be lurking. Spider bites. Spiders use a kind of venom to paralyze their prey. Most spiders are relatively harmless to man, but some types are dangerous, particularly to young children. Spider venom affects nerve endings, causing weakness, dizziness, and nausea. Breathing may become difficult, and the patient may even go into shock. Convulsions may sometimes occur in small children following a spider bite. What to do? Put the patient to bed and apply a hot water bag or other gentle heat to the abdomen. For severe bites, calcium gluconate should be injected by vein. ACTH or cortisone are also valuable in relieving this condition. Use DDT to spray the areas where spiders spin their webs. This will destroy the spiders and also the insects on which they feed. Centipedes. Centipedes have a pair of hollow fangs through which they inject venom into the skin. Usually this produces a local reaction. But in certain tropical areas the bites from large centipedes may cause swelling, fever, vomiting, and a severe headache. Treat as suggested above for spider bites. Scorpions. Scorpions have a single curved stinger in the tail, through which they inject a powerful venom that produces severe burning. 132. Bites and stings. Pain, followed by convulsions and temporary paralysis. Nausea, vomiting, dizziness, and headache are common after a scorpion sting. The pulse may become weak and the breathing rapid. Scorpion. Tick bites. 133. Venom may even produce acute pancreatitis, a very serious condition, especially in young children. Treatment: apply a tourniquet above the area, similar to that used for snake bite, see page 111. Lay an ice pack over the injured area to relieve pain and slow the spread of poison. Treat as for severe spider bite. Local injections of Novocaine will also relieve the pain and help to prevent shock. Keep the victim lying down. Ticks. Ticks are prevalent in certain parts of the world. They often carry spotted fever, thick typhus, and other serious diseases. If untreated, the poisons from the tick may paralyze the brain and heart. What to do? Remove the tick from the skin by applying a lighted match to its tail. This causes the tick to let go of the skin. If the heat is applied too rapidly, however, it will kill the tick before he has time to pull his head out of the skin. Be sure the tick's head is completely removed. An alternate method is to apply a drop of kerosene to the tick. This causes him to loosen his hold. If a fever develops, call your doctor. Always examine the body carefully after being out in areas where ticks are abundant. 134 bites and stings. Bees, wasps, hornets, and ants. All stinging insects, such as bees, wasps, hornets, and ants, have a similar type of venom. Treatment is much the same. Always be sure the stinger of the bee or wasp is removed from the wound. Then apply a weak solution of ordinary household ammonia. If very painful, some local anesthetic, such as Procaine, may be injected around the sting. Ice cubes over the injured area will help reduce the pain and swelling. Alternating hot and cold applications may be helpful in more severe cases. See page 96. Note: some people are highly sensitive to bee venom and may have to be desensitized by special treatment in hospital.